People don't know what occupational therapy is. And so now I'm a double-horned unicorn because not many people know what pelvic health is. And I think part of it is that brand recognition, just not recognizing. I really believe that all healthcare needs to be trauma informed. How do I serve this client in front of me? By just listening. I know that sounds so simple. So I think just not coming in with an answer, not coming in with an expectation. I think sometimes we rush in kind of already ready to fix and solve the problem, when sometimes it's as simple as sitting there. That can hire occupational therapists don't actually recognize that an OT can be a pelvic health therapist. I'm so confused about how to become a pelvic floor therapist. Why isn't it clear?
Hello, I have the pleasure of having the Lindsey Vestal joining me on the Pelvic Health Network. Lindsey, how are you doing?
Oh, Rebecca, I am phenomenal. The fact that I can spend this time with you, be a guest on your platform, the honor is all mine. Thank you so much.
Thank you. I actually prefaced this conversation today with a post of just reflecting of my own clinical journey and just the conversation and how powerful it's going to be today. Because when I was practicing full time in the hospital, my first advocacy, if you can even call it that, I didn't know what I was doing really as an acute care therapist. But when I think of the advocacy that needs to happen around pelvic health, occupational therapy, if I can date back my advocacy, it was when I was treating patients that I knew would be better suited to have occupational therapy be part of their care team. And those patients were after cesarean hysterectomy, which I recently wrote about and spoke with Dr. Karen Fox, a OBGYN maternal fetal medicine specialist, who mentioned in her talk with me that if we're not offering occupational therapy services or physical therapy services or nutrition, registered dietitian services, then we're actually, we're disserving our patients and providers. And I
Yes.
knew that in 2020, I knew that working with her team that we needed an occupational therapist on board. So when I came across your work, Lindsey, I knew this conversation was long overdue. I knew we had to have it publicly to really just kind of like lay it out. What are the issues and the barriers to occupational therapy services being accessible to patients after surgery, after birth, with pelvic floor concerns? What are those issues and what can we do about it?
Such a phenomenal conversation. Thank you for having it. Thank you for opening the door to having it, because I think until we start to have these conversations, the barriers aren't going to be removed. So I'm looking forward to the dialogue, and I'm really looking forward, Rebecca, to hearing your perspective on this as well. It's multi-layered, it's multifaceted, as most interesting problems to solve are. The first thing that comes to mind when you ask that question is really that I think people don't know what occupational therapy is. I remember 2 years into my graduate program, we were still defining for ourselves what we were. And I was a slightly older student. And I remember thinking, this is going to be a problem, isn't it? And at that point, I knew I wanted to be in pelvic health. And so now I'm a double-horned unicorn because not many people know what pelvic health is, and people don't know what occupational therapy is. So I think part of it is that brand recognition, just not recognizing. You go down any Main Street USA and there's marquees that say physical therapy. You don't really see that in OT. So it's not a common term in most households. I didn't even know what OT was. It was about 6 months before I was applying to graduate programs. I was going to go to be a pelvic health physical therapist. I knew my specialty already. And I was shadowing, getting my hours in, and I accidentally, got exposed to an OT. My life changed ever since. So I think part of it is the accessibility of the profession and people just not quite understanding us.
That's so funny that you say that because I was exposed to occupational therapy. I knew what it was. I actually worked as a rehab tech. We weren't PT or OT techs. We were rehab techs for both disciplines. And my first introduction to pelvic health OT was with an occupational therapist, really talking in depth about sexual health and sexual function with a woman who had a C6 spinal cord injury, who very much, still wanted to have the ability to have children, have the ability to have sensation with sex. And I'm in this conversation, we were doing peri-care and teaching her how to manage her own peri-care. And I'm listening to this occupational therapist explain sexual health and sexual well-being. And I'm blown away. I knew I wanted to be an occupational therapist. And honestly, the switch happened kind of at the last moment because of the brand recognition that PTs had, the DPT. I wanted to be a doctor. And now I'm looking back on my practice over the past few years and I'm like, oh, there's so much in terms of like the breadth and depth of your scope of practice, the mental health roots. And it's just like, wow, I really needed trauma informed, education in my pelvic health practice. I really needed that to be the foundation versus the biomechanical model I learned in physical therapy school. And now I'm kind of backtracing, but I will not go back to school. I'm done, Lindsey. But and part of the reason why I'm just such a proponent for the OTs and Pelvic Health Summit is because I'm learning now things that I wish I would have known early on in my pelvic health practice journey.
Rebecca, something you said there really struck me, which is this idea that perhaps all pelvic health therapists should start with a trauma informed biopsychosocial approach and build from there. We can get those hands on skills. We can acquire that biomechanical approach. Those of us that find ourselves in the therapy world, I think, are inclined to that already, kind of learn in that way. However, I think that when it's so powerful to hear you say that. I think I know, I believe that deeply in my heart, but to hear someone like you say that, a doctorate of physical therapy, someone who is just an absolute visionary and source of light for all of the people you serve, not only the programs you help develop, but all the clients you've had the privilege to interact with. And to hear you reframe it that way, I have to tell you, my heart is singing, because I really believe that all healthcare needs to be trauma informed, of course, but the statistics are just too high for pelvic health therapists to not be trauma informed, to not come from a nervous system first approach. So let's say that again loud and clear. That is so powerful that you are, re-examining your biomechanical training to kind of fit it into the myriad of tools, right? We don't just practice from one approach. We are not that linear. Thank goodness. Life is not interesting when it's black and white, but it's this mixture and this beautiful ability to sit across from the client in front of us, use therapeutic use of self to decide which tools do we start with, providing agency to the client to also help us make that choice. Because you know what? They know their body best. Sometimes they need us to help remind them of that, to be that facilitator, but 100% they know what's best. And if you pause and maybe have that awkward moment when you're waiting for them to answer a question and not jump in with the answer, very often that pause is where that magic happens and they realize, she wants me to be the agent in my care. Okay, I'm going to have to answer this question before we move on, aren't I? And that's just the stepping stone. That's just the start of their belief again in their body. And this is when real healing occurs.
And so I want to make that tangible because to me, I think that could be missed by so many people, like what you were just saying, like having a person be an agency, in their own care. And it's top of mind, I have to say this is with an occupational therapist who's practicing in a level 1 trauma center. And she is interacting with patients with these very, very heavy cases. And she's like, what do I do? That's where the question and the training really starts. What do I do with a person who had, in our case and in our educational program, we're primarily training occupational and physical therapists to see patients in the hospital after birth, any birth outcome. And that question of what do I do, really, if it were in a trauma-informed lens, would be what? Not what do I do, but what, Lindsey?
How do I serve this client in front of me? By just listening. I know that sounds so simple. And I know that sounds, here's the thing. Simple is not profound. Simple can still be so profound. And so I think just not coming in with an answer, not coming in with an expectation. You have all that training and it's beautiful, and thank goodness for it. But I think sometimes we rush in kind of already ready to fix and solve the problem, when sometimes it's as simple as sitting there, and a simple question that comes to mind when you ask that question is just looking your client in the eye and simply saying, what does life look like when you solve this problem? What does life look like when you're on the other side of this? I think sometimes when we're entrenched in an injury, it's really hard to see what's next and what comes after this. And so I think just holding space for a very optimistic, hopeful, joyous question, which is what's next when you meet this goal, starts to help the client imagine and then almost backtrack the steps that it takes to get there.
Absolutely. And I'm thinking specifically in her case, she was working with a client who um, showed signs of perinatal mood and anxiety disorders, just immediately after birth. And I think of really the trauma informed lens that I want clinicians to really have working with this population. And I realized there's really nothing that exists until the trauma informed pelvic health certification that you and Laura created. There's really no strong foundation, even in both of our educational kind of journeys as DPT students and as OT students. There's nothing that's preparing them for the trauma that the pelvic health population brings a lot with their cases. I mean, I am on the acute care side of things, but we have people struggling with issues for years and years until they find a pelvic health therapist. And then to find a pelvic health therapist that dives right in and starts doing a pelvic floor exam and using a biomechanical model and doesn't stop and pause and listen, that to me can just further exacerbate that trauma. And really, I mean, I have been transformed by this program that you've created, because now I'm going back and I'm analyzing a lot of the years of practice, where I've been in patient care, and just kind of questioning, could I have made that experience better? Could I have done something differently? And it's good. I like that is happening now, but it's also been hard. It's hard to
Oh,
accept that there's a lot that I've probably did that added to that trauma.
well, Rebecca, thank you for saying all that. And to your point of kind of going back and doing a bit of a moratorium to the clients you've had the privilege of serving, and then recognizing that now with this knowledge that you have, you could do differently. I want to say that I want to reduce any shame or any negativity you have when you sort of are evaluating that about yourself. I just had the distinct pleasure of serving the first OT Pioneers hands-on lab this past week. And up to this point, my course has been all online. And, I am loving these in-person events. Between the summit, the Sedona retreat, I'm like, okay, how many more times can I get into a room with pelvic floor therapists? Because it just lights me up. And, the conversations were pretty deep. It's all beginners. And they said, what if I do wrong by my client? What if I can't serve them the way that I want to? Here's the thing, until we get started, until we actually have those opportunities to see where our gaps are, or to be able to be present and see even the sequence of events. Remember when you didn't even know what an evaluation looked like? Those beginning days when you're wrapping your head around what's the rhythm? How much time do I give to the internal exam? And the thing is, we have to be messy in order to evolve, and it's not until we allow ourselves that grace to start seeing clients and to start making mistakes, we're not going to arrive at that place that we imagine ourselves being as the best practitioner. Every day, Rebecca, I thank my first, gosh, let's be honest, 5 years of clients for teaching me all that they did, because I couldn't do better until I got started. So I just want to say that thank you for caring so much. Thank you for not being on autopilot. But let's also give ourselves the grace of recognizing when we know better, we do better. And then you didn't know at that point what was capable and what was possible. So I give gratitude to those initial clients, and then we just keep moving forward and giving better and better care, and being the advocate and the visionary that you are for us all.
You know, we have to be messy in order to evolve. That's honestly, that's what I think about in terms of like pelvic health, you know, kind of our field as a whole, right? I had the pleasure of being in our first in-person OTs and Pelvic Health Summit with Jenna, with my spouse, and to see her eyes, like she's not a pelvic health therapist. She is a neuroclinical specialist in physical therapy. She's now an assistant professor in a DPT program. She really doesn't, go to pelvic health events with me. That's just not what she does. And she was floored at how impactful it was for her, just personally, just things that she has kind of shared publicly about her own trauma, and just being in a conference led by OTs was completely transformative. And we experienced that together last year. And so I think about that messiness,
Mhm.
right, of pelvic health. I mean, we're still a new field that doesn't offer our services in the hospital. Like when you think about that, when you think about cardiology and neurology and orthopedic, we have tentacles in those fields of every setting, and we're still growing. It's messy. And I think about the lack of providers, right? To even focus in on a discipline that feels so messy to me,
Yeah.
Lindsay.
Yeah.
In order to evolve, we have to recognize it's really messy right now to make this discipline specific. What's been your driving
Mm.
like urge to really expand pelvic health providers, the amount that we have? What's been your story?
Yeah, I mean, first of all, providers is a wonderful word because I don't think OT, I don't think PT. I just think how are we going to meet the needs of all the people that need us? And I have personal stories, not only from my mom, who actually passed away from complications of a stage 4 prolapse, to my father, which is the reason I got into pelvic floor therapy to begin with, which is the fact that he had prostate and bladder cancer. And he had very frequent urgency and incontinence. And I saw him completely withdraw from his life, to then my own birth story, where I had a 3.5-degree tear and was fecally incontinent. So it's strongly within me, for my own experiences and for my parents. But then also there's just all of the stories, all of I'm one of those people, Rebecca, who I love having difficult conversations. I really like, holding space for conversations that are not common dinner party conversations. I enjoy that. And so for me, being able to connect people with providers that can open up this sacred space to reclaim who they are, to feel comfortable in their own body again, to feel the optimism and that we all deserve to feel, is so incredibly compelling. I mean, there just isn't a greater privilege, you know? And so then to step into this place now where I have this opportunity to continue to build the community and to help OTs become, step into this work, which like is just the best job in the world. I just, it started with a personal story, and then it has grown to every single person in the world that I have had the honor to not only support, but my students to support, because I hear their stories. I'm with them, and so it's like just there's nothing like it. So I think there's that aspect of it, of being able to provide care to those that need it and keep those spaces open and not dismiss, right? There's that. And then there's also just the fact that I just so wholeheartedly believe in what occupational therapists bring to every setting that they're in. I feel like we have a long history of imposter syndrome. We have a long history of kind of being a jack of all trades. And so people sometimes don't know what we do. You can meet one who's in a school setting. You can meet one that's in a SNF. You can meet one that has their own pelvic health private practice. And you're thinking, what is this profession? Right? It's like there doesn't seem to be a common thread. And so I'm just such an advocate. And that doesn't mean I'm not an advocate for PT. I love PTs, but I am an OT, and I can see how sometimes we hold ourselves back with our lack of confidence. And I want to see that change. I want to see us grow into the pride of the fact that, come on, we are mental health professionals. Like, we combine the mind and body. That is where true healing begins. We have that creativity, we have that flexibility to design and work alongside our clients to bring them the very best care that we can. And so I just love us. And so I think that's a huge driving force there as well.
What do you see in terms of specific barriers because of that either lack of confidence, that lack of brand recognition, that imposter syndrome that you're describing in the profession as a whole? What do you see are the barriers specific to pelvic health? I mean, I've been a little bit like shocked, but I really just need to kind of step back and hear it from an OT. I don't understand why a pelvic health therapist who's an occupational therapist would be turned away when we need so many, when we're so um, we're underserving our patients. I mean, to have a 6 to 8 week wait list to see a pelvic health therapist is a disservice. It's a disservice to our providers. It's a disservice to people. When I think about the story that you just shared about your parents, and to know that they had pelvic health histories that significantly impacted their lives, your life, that is just, to me, is just like an aha moment. We can change this. We can expand the providers within pelvic health. What are the barriers that you're seeing, Lindsey?
Mhm. They're so multifaceted. I think the first is that many systems that can hire occupational therapists don't actually recognize that an OT can be a pelvic health therapist. So what comes to mind immediately for me is like when I applied for my first job over a decade ago, my resume just kept getting passed over at the HR level because I didn't meet the core requirements of being a physical therapist. I'd already taken, tons of coursework. I had the proficiency. If I had been a PT, I would have been hired like that. But because they thought, oh, this is not the discipline we're hiring for, it just kept getting passed. Well, Rebecca, I'm a bit of a stubborn person and I don't give up. And so, I went and knocked on the door. I met the director personally, and they were able to bypass that HR requirement. Not everyone is as bold, nor should we have to be, And so, number one, there's the systems perspective of our resumes just getting passed over because we're not, quote unquote, meeting the core requirements. There's that aspect of it. There's also some other concerns, right? So some of the ones that come to mind that I've heard a lot of physical therapists that I've loved engaging in dialogue around this are, we don't have the background in sort of the lumbar orthopedic considerations that physical therapy do in school. And so I think many of them think that perhaps the core foundational skills aren't there for us to be able to support our clients in a holistic way. So I think there's that. And then there's also the fact that I just think as a profession, we've had a bit of an identity crisis in terms of sort of knowing our worth. This is broad strokes. I don't want to speak for every occupational therapist out there, but my husband Doug helps OT start their own private pay practices, and I hear that a lot from him too. And he doesn't just work with pelvic floor therapies; he works with all OTs. And there's always this deliberation of, can I do this? Am I capable of this? Am I enough? And I'm not so sure where that starts, Rebecca. I don't know, but it feels very pervasive for me right now. It's actually one of the reasons why I've started a certification program. For a very long time, I was against a certification for a lot of reasons. First is I don't want to make it harder. I don't want the barrier to entry to be harder. I started super scrappy. I'm a very DIY person, roll up my sleeves, get it done. If I feel this passion, this calling, it's going to happen. And so I always thought, well, there is no formula, there is no structure in place. Why create one? And I was talking to a student an OT who said, I'm becoming a lactation OT, but I'd also like to offer pelvic health services. And, when I look up how to become a lactation specialist, there's a graphic and it's a very simple path 1, path 2, path 3. This is how I can do it. I'm so confused about how to become a pelvic floor therapist. Why isn't it clear? And I've heard this probably thousands of times since I've had the privilege of supporting OTs and creating communities. There was something about this that really struck me that I thought, we're actually stopping people from entering this field because it's not clear enough versus what I thought the opposite was. I thought if there was a structure, that it would be hard to enter. And there's just a light bulb moment. So I'm so grateful for this OT reaching out to me about this. And so now I'm creating a very rigorous program with core competencies, knowledge, skills, and abilities that the largest employers of occupational therapists will recognize, because we're meeting their standards and beyond. So that now, look, you don't have to do this program to be a therapist, to be a pelvic health OT, but if you want a reason to walk into a room with confidence and say, this is why you should hire me. This is what I can sign off. There's actually over 200 core competencies that they can sign off with this program. Let's do it, and if that's what you need. And so it's kind of listening to the needs of the community. And like I said, by no means is it a requirement at this point, but for those that want that structured path and want that confidence to not pass over a job that in their heart they feel they want and need, let's bring it. Let's do it so that we can no longer have 6 to 8 week long waiting periods. We can have every community have the ability to walk in and be treated by a pelvic health professional and have that hope, have that optimism, be able to reclaim their life again.
You know what, the business advisor at Goldman Sachs, I was involved in the 1 Million Black Women Goldman Sachs business program. And the one thing that sticks out about what your comments were about the certification was that when you're creating a certification, that's industry standard, right? That's something that your industry can recognize as a standard pathway of creating competency, right, in your profession, whatever that is. You're serving not just your profession, but you're serving your clients, your patients, and you're serving your referring partners, those other industry leaders, whether they're in healthcare, whether they're the OBGYNs or the urologists or the pelvic health practitioners, the midwifery services that are complementary to your pelvic health services. You're serving the whole industry, right? When you're creating a certification, because you're creating a standard that people can recognize that this is the professional who can meet my needs. This is a trauma-informed professional who I know is going to understand my physical as well as my emotional journey. This is a professional I can refer to because now you've created this standard of practice, right? And so it's really, Lindsey, what you've created is serving so many different people, especially the people that we all want to impact by your certification. Please tell me more. What is the name of the certification? Where can people find it? What is the entry point for people to get started?
First of all, thank you for saying that. That just makes my heart sing to think about that ripple effect. So I love that. I first need to give a shout out to Kelsey Matthias. She is the person who I created the OTs and Pelvic Health Summit with, and she is also my partner in crime, do or die ride for this certification. She is I can't tell you how incredible she is.
I've been following her work with with our military service. I mean, she's on the federal level as an OT, as a pelvic health OT, making changes. So yes, Kelsey Matthias, awesome. Yeah. That's your partner in crime.
That's my partner in crime. And so her and I are working on this behind the scenes. And so the best thing to do is to go to functionalpelvis.com/levels. Applications are going to open in January 2025. And so, we're rolling this out really methodically and really carefully. And so, there are levels that you can do to you don't have to go for the certification. I think the certification is going to be the most enlightening, because that's where you then also have the trauma-informed component. And I struggled long and hard. You and I have had many conversations about this. I want to start with the trauma-informed, and eventually I feel like that's something we can do. But as of now, it's the foundational coursework, a colorectal course, that's your level 1 and level 2. And then in the certification process, it's the trauma-informed work as well. And so after that, you're going to be able to speak to over 200 competencies to then, I'm imagining a practitioner walking into an HR department or a hiring manager and saying, I'm a functional pelvis holistic practitioner, and this is what I can, this is the document I can ascribe to and tell you I can meet these competencies, I can serve your clients in the most robust way possible. And the hiring manager just says, when can you start? Like that's the kind of level of conversations that I'm imagining happen with this ripple effect. And we're going to do so much advocacy behind the scenes to let every setting who hires pelvic floor OTs and PTs to know about this certification. They're going to know the quality of the practitioner that actually receives the certification, so that you're not out there floundering and trying to explain it, right? We're going to give you all the verbiage, but we're also going to be doing all the advocacy behind the scenes to let employers know about this program.
And that's the huge part. That's what people probably really need the most is the advocacy
Yeah.
behind it. 200 competencies, that to me is like you're hired. Like, please, like,
Yeah.
when can you start? Absolutely. But the advocacy behind this, there's going to be really a big shift in our at the provider level, to be honest with you, in terms of how they're routing patients to us sooner. And we just really need to let them know, here we are. And so what can people now do in order to either prepare? Are there any prerequisites? I'm still kind of thinking like January
Yeah.
2025, if I'm a student who's graduating this summer, what do I need in order to pursue this certification? What's the entry point?
Yeah. So, I mean, a great entry point is OT Pioneers. That's my flagship intro course. After that would be OT Elevate, the biopsychosocial approach to colorectal conditions. Those two together, combined with the in person labs that we offer, make you a level one. Level two is taking the trauma informed certification. After you've taken basically an intro course, a colorectal course, and have trauma informed care under your belt, you can now sit for the certification. You don't have to just take my courses. As long as you've taken a course that can sign off on the competencies, you can still sit for the certification. I will say the one caveat there is the trauma informed certification, which is that key component to be the level two. As of right now, Laura and I's trauma informed certification is the only program out there that you can take. But in terms of the other courses, you can absolutely take them as long as they sign off on those core competencies. And sitting for the certification is kind of the proof for that, right? Have you been able to take some of these PT led courses and be able to internalize them through an OT lens? Because that's the thing, right? Like we have to often reinterpret some of these courses through our practice framework. So obviously, if you take my courses, that's kind of built into it innately. But I think all the OTs out there that have been taking other courses are doing this already, right? It's in our DNA to think like an OT, to think in that holistic way. And so when you sit for that certification, as long as you're demonstrating that you can do that, by all means, let's give you that certification.
Yeah, to bring this full circle and to just kind of like close off this conversation, Lindsay, as a women's health clinical specialist, that's my certification. That was kind of my real entry point into holding up my flag and putting the sign on my door and letting physicians know who I was to refer. I'm still backtracking. And when I say that's not a place of shame, it really is just acknowledging that I had the level one, I had the level two. I even went further. It wasn't necessary for our certification, but I did further work in pediatric pelvic floor, male pelvic floor dysfunction. And I realized if I had had a trauma informed component to my practice, my approach would have been a lot different, especially when I transitioned into the acute care environment and I was seeing women after perinatal loss. To be in the room with a woman who's holding her baby who's not alive, I could go through those courses again. It would not have prepared me for those interactions. It just truly wasn't. And until I was in the trauma informed certification program in the Sedona retreat, I was floored at how much you were giving us. And I realized, well, I'm in a room of OTs, the lone PT, and this is embedded in your practice. Like, I can't think of a more qualified profession who are now offering and expanding their services to the pelvic health population. That's how I think about it. I don't think about pelvic health OTs. I think about the profession who's expanding their services to people with pelvic floor dysfunction or after birth or in the surgery or in the hospital after a pelvic surgery. And so I'm ready. I'm just like, when does, I will be at every summit. I can't wait for the added benefit that it's been to my practice, to my profession, just to be a part of the OTs and Pelvic Health Summit annually. But this certification is just, I can't wait for it to launch. I'm just so thankful for what you're doing, Lindsey, really.
Thank you, Rebecca. I can mirror everything that you said for the work that you and Jenna are doing. And I just want to say that my kiddos who you and Jenna rock climbed with at the fundraiser event at last summit, they're ready to challenge off. They want to be there with you all. And they are just chomping down the hours. Like, when are we going to rock climb with Rebecca and Jen again? And also remember all of the new people that we introduced rock climbing to, and like they took off, like the support that was there. That's just like a microcosm of this event. And also just the community that we're building, Rebecca, of people that care to walk alongside one another. And that's it. I could imagine and see that at the summit, at the rock climbing, and every step ever since then. Those of us that just don't care about the discipline name. Do you have an O in front of your name? Do you have a P in front of your name? Let's just put all of that aside, serve our clients, and support one another every step along the way.
I completely agree, and I cannot wait. You tell your kids I will be ready with my rock climbing shoes. I absolutely, one of the best conferences that Jenna and I have attended, and we say hands down, we're lifelong summiters, OTs and Pelvic Health Summit. And yes, we felt welcomed. It's an amazing conference. Again, remind us when that conference is, Lindsey,
It's
and how
August.
can people be a part of it?
Well, we
Still.
are sold out. We've sold out the last 2 years. It's August 17th and 18th. We not only have our current AOTA president coming, but our incoming president, Dr. Arame, who's going to be there. She's actually doing a TED Talk like you are, Rebecca. And so it's just the robustness, the level of support that's going to be there. We have tons of PTs that are not only speaking, we have some attending as well. We love them. We love when PTs come. But recording tickets are still available. So if you're feeling,
I was going to say,
yeah.
there's no way to be a part of this. Okay, so recording. So how can people get those? I'm looking and I'm like, okay, that's still open.
Yeah. So functionalpelvis.com/summit. They're $297 for the recorded tickets. They do come with AOTA CEUs this year. That's new for us. So we have 1.6 CEUs with that. And also we have a professional videography team coming. They're going to capture every moment of the conference, like close up. So you're going to see those hands-on techniques overhead when we have our labs. Like it's going to be the next best thing to being there.
Awesome. Lindsey, this has been amazing. Thank you so much for your time, for your advocacy, for this new program, certification, and opportunities to really expand pelvic health care. Thank you.
Thank you, Rebecca, for all that you do, for really passionately, innately supporting us. We really feel that, and we really feel the fire you're putting underneath us to create this collective change, and that's what it takes. And so, actually, thank you for everything that you're doing to move this forward. We are beyond grateful for you.
Same here, Lindsey. We'll speak soon.
Sounds great. Thank you.